Every year in the U.S., there are 100,000 deaths from infections that are acquired in the hospital. They're called nosocomial infections. And 1.7 million people will be involved with those infections. This is a huge number. It makes you think that going to the hospital isn't safe. And indeed, about 5% of people, at least, who go to the hospital wind up with a nosocomial or hospital-acquired infection. And now an article has come out that shows that it's even worse than we think. In patient rooms where people had infections that were serious, what they found is that about half of those rooms still had that organism present in the room if they cultured for it on a lot of places. Things like on cart handles, on floors, infusion pumps, ventilator touchpads, bed rails, and many more areas that are inside the room. That means that up to 2 months prior to the time that a patient was discharged from the hospital that had that infection, it's still present in a lot of the rooms. That doesn't mean that half of all hospital beds or hospital rooms are infected, just those where those infections existed. But those are the ones that we worry about the most. And the question is, what can we do about things like that? What plans do we use that are going to change the situation? You know, it was just a few weeks ago that we talked on drsaputo.com about the effect of copper, using copper alloys on all kinds of different surfaces, because 97% of the microbes that come in contact with copper are dead within 90 minutes. And that includes things like MRSA, all the bad infections, or C. diff, all the bad infections we're talking about. And yet, no hospitals are taking steps to bring copper into their rooms, particularly in those rooms where there are infections that repeatedly are brought into the same rooms, like the infectious disease wards. Something needs to be done about this to change the situation. What we do use are very toxic products that patients shouldn't be exposed to, because they take a lot of detoxification effort on our body to be able to deal with them. And when we're in the hospital, we're already toxic. And we've got enough in the way of problems trying to keep ourselves well, let alone tax ourselves with the soaps, the disinfectants, the floor cleaning agents, the things that are used to try and sterilize rooms. We should be looking for new ways to deal with that. Years ago, we used to use UVB light. I remember the surgical suites when I was in Duke back in the 60s, and when we had these lights on that were really bright and infections were controlled that way. Maybe we should be using UVB lights in addition in some of these rooms where people are already infected, because we have to do something to stop that. We can't be sending patients into infection-laden rooms so that they are at risk for coming down with that infection themselves. Think about it. When you come to the hospital, you're not in your best form. You've had problems with your health, and your immune system is probably not strong. And by the time you're finished, even with an elective surgery, your immune system is not what it was when you were at your best, and you're still at risk for developing things like MRSA, C. diff, vancomycin-resistant enterococci, and now they're talking about acinetobacker baumannii, which is the particular microbe that they studied when they looked to see if that bug would still be there in those patients that were infected 2 months later. And indeed, that was the case. So we need to do several things. One, we should take better precautions about making sure we don't spread infection. Our doctors should be making sure that they wash their hands, that they're wearing gowns that are disposable, and everybody who comes into a room in a hospital should be thinking of, how can I prevent infection from getting into this room? We should be looking at copper on many different surfaces, all those surfaces where you can't clean well and where you have to have sterilization to occur. That would be a big shift in a positive way. We also need to be looking at lifestyle of people who are in the hospital. How do we boost immunity? Give them enough sleep. Give them some decent food, which would be a shift from what most hospitals deliver as optimal nutrition. We should be giving immune support, reducing their stress, maybe adding music for relaxation, and maybe even bringing animals in like dogs for comfort and for ways to relax a bit. There are lots of things we can do to build up our internal forces that fight infection. So when we're looking at this problem of nosocomial or hospital-acquired infections, it's a big deal. And we sort of just like accept that it's a big deal, but we're not taking any action. It's time that our hospitals start taking more action. It's time that our doctors start taking more action and make sure they're not causing the spread of infection. It was just a couple of years ago when we knew that doctors' ties became infected. We should be using copper pens and pencils because they will sterilize things. So all these things, besides boosting immunity and boosting the person's ability to be able to detoxify better, are things that are on the agenda of how we can start keeping infection from killing 100,000 people and affecting 1.7 million people every year in our hospitals.